If you are over 60 and you masturbate regularly, there is something your doctor has almost certainly never told you, and it may be quietly damaging your erections, your prostate, and your ability to feel sexual pleasure at all. Not because the act itself is the problem, but because the way most men over 60 do it is completely wrong for where their body is right now. Most men your age were taught nothing, not by their doctors, not by their fathers, not by anyone. You learned in the dark, fast, focused only on the finish line. And for a while, your body was young enough to absorb the damage. It is not anymore. What worked at 25 can quietly rob you of function at 65. Stay until the end of this video because the last point includes a simple daily practice that most urologists never mention, and it may be the most important thing you hear this year. Here is the truth most men do not want to face. The habits you built decades ago are still running on autopilot inside your body. And your body at 60, 65, or 75 is operating under completely different rules. Starting with number 7. Number 7 is about speed and why rushing is one of the most quietly destructive things a man over 60 can do during solo sexual activity. Think about what happens when you move too fast. Your body never fully enters the arousal cycle. Blood flow to the penile tissue is incomplete. The smooth muscle inside the penis, the tissue that needs to fully relax and fill with blood for a firm erection, never gets the signal to do its job properly. Over time, this conditions your nervous system to respond only to intense, rapid stimulation. And real intimacy with a partner rarely works that way. One patient in his late 60s told me he had no problem finishing alone, but could not maintain an erection with his wife of 38 years. He was devastated. He thought it was psychological. It was not. It was a trained response. His body had been conditioned for speed, and it had simply forgotten how to respond to anything slower or more natural. When he slowed down his solo practice, deliberately, over several weeks, sensation returned, function improved, his marriage changed. Speed is not efficiency. At 60 plus, speed is a liability. Number 6 brings us to something that might genuinely surprise you. A study published in the journal European Urology, one of the most respected peer-reviewed publications in our field, followed over 31,000 men across an 18-year period and found that men who ejaculated 21 or more times per month had a 33% lower risk of developing prostate cancer compared to men who ejaculated 4 to 7 times per month. The researchers concluded that regular ejaculation appears to reduce the buildup of inflammatory fluids and potentially carcinogenic substances inside the prostate gland. Think of your prostate like a small internal reservoir. If that reservoir sits stagnant for too long, the fluid inside it can become concentrated, irritating, and over time, dangerous. Regular mindful release acts like a natural flush. The American Urological Association recognizes prostate congestion as a real and underdiagnosed contributor to chronic pelvic pain and urinary discomfort in men over 50. If you have ever experienced that dull ache deep in your pelvis or felt like your bladder never fully empties, stagnant prostatic fluid may be part of the picture. This is not a minor footnote. This is physiology that directly affects your daily comfort and your long-term health. Before we continue, pay close attention to this because it is important. Many men come to me thinking that the problem is just age, but the truth is, the issue is almost always the blockage of a specific enzyme responsible for your circulation. If you want to fix this at the root, I have pinned a link in the first comment of this video with a 14-day clinical dossier that teaches how to naturally reactivate this enzyme. If you prefer, you can also point your phone camera at the code appearing on your screen right now. Number 5 is about something almost no man wants to admit: grip. Specifically, the grip pressure most men have used their entire lives during solo activity. There is a recognized clinical pattern, sometimes called death grip, where years of high-pressure, high-friction stimulation gradually desensitizes the nerve endings in the penile tissue. These nerve endings are responsible for transmitting pleasure signals to the brain. When they are chronically overstimulated with intense pressure, they adapt by becoming less responsive. It is the same reason a man who works with his hands every day eventually loses sensitivity in his fingertips. Your body protects itself by numbing what it cannot fix. For men over 60, this is especially serious because testosterone levels are already lower, meaning your baseline sensitivity is reduced. Add decades of aggressive grip on top of that, and some men find they can barely feel anything during intercourse. They assume it is age. It is not entirely age. It is a learned pattern of desensitization that, with patience and deliberate change, can be partially reversed. Lighter touch, slower pace, and longer sessions without rushing to the finish line are the starting points. This is not just about pleasure. This is about keeping your neurological connection to your own body alive. Number 4 brings us to testosterone, and this is where the science gets specific. A study published in the Journal of Endocrinology found that short-term abstinence, specifically around 7 days without ejaculation, produced a measurable spike in circulating testosterone levels, peaking at approximately 145% of baseline on day 7. After that point, levels began to return toward normal. This study, conducted in healthy adult males, suggested that the body has a natural testosterone rhythm tied to sexual release. Why does this matter for men over 60? Because when your body already produces less testosterone than it did at 40, and the Cleveland Clinic estimates that testosterone drops roughly 1 to 2% per year after age 30, every natural lever you have to support your hormonal environment matters. Strategic timing of sexual activity, whether solo or partnered, is a lever most men over 60 have never considered. This does not mean deprivation, it means awareness. Spacing sessions intentionally, rather than acting purely on impulse or boredom, may help your body maintain a slightly stronger hormonal baseline. That translates to better mood, more energy, stronger morning erections, and greater interest in intimacy with your partner. Number 3 is about time of day, and this one runs directly against what most men do by habit. The vast majority of men over 60 who engage in solo sexual activity do so late at night, right before bed. It feels natural, the house is quiet, there is privacy. But here is what that timing actually does to your body. Orgasm triggers a release of prolactin, a hormone that promotes sedation and reduces dopamine levels. That crash feels relaxing in the moment. But prolactin also suppresses testosterone temporarily, and when this happens consistently at night, it can interfere with the testosterone-producing work your body normally does during deep sleep. Your body releases its largest natural pulse of testosterone during REM sleep, specifically in the early morning hours. If your hormonal environment is already suppressed when you fall asleep, that overnight production cycle is weaker. Over weeks and months, this adds up. Some men notice it as morning fatigue. Others notice that their morning erections, which are one of the most reliable indicators of vascular and hormonal health, begin to disappear. Morning erections are not just a curiosity, they are a clinical signal. If yours have faded, pay attention to what time of day your habits are sending your hormones in the wrong direction. Number 2 brings in research that directly connects mental state to sexual function in older men. A study from the Archives of Sexual Behavior examined how psychological context during masturbation influenced long-term sexual satisfaction and erectile function in men over 55. The findings were clear. Men who engaged in solo sexual activity accompanied by shame, anxiety, or the need for extreme novelty, such as progressively more intense visual content, showed significantly higher rates of erectile dysfunction and lower relationship satisfaction compared to men who approached the same activity with a calm, body-connected mindset. The researchers described a feedback loop where shame and overstimulation together train the brain to require escalating input just to achieve arousal. Over time, real-world intimacy, which is softer, slower, and emotionally complex, cannot compete. The brain has been rewired to need something it can only find alone, in front of a screen. This is not a moral judgment. This is neuroscience. The brain's reward system, driven by a chemical called dopamine, adapts to whatever level of stimulation you repeatedly feed it. If you consistently feed it high-intensity content, ordinary intimacy begins to feel flat. For men over 60, whose dopamine sensitivity is already naturally lower, this pattern is especially damaging. Reconnecting with sensation, with the physical present moment, without escalation, is not just good advice, It is a clinical intervention. And finally, number 1, and this is the one most urologists will never bring up in a routine appointment, partly because it takes too long to explain, and partly because patients are rarely comfortable asking. It is about pelvic floor muscle engagement, or rather, the complete lack of it. Most men have no awareness of their pelvic floor at all. These are the muscles that run along the base of the pelvis, supporting the bladder, the rectum, and playing a direct role in erection quality, ejaculatory control, and urinary continence. In younger men, these muscles tend to stay reasonably toned through normal activity. In men over 60, especially those who spend most of the day sitting, at a desk, in a recliner, driving, these muscles weaken significantly. And here is what that means in practice. Weak pelvic floor muscles mean weaker erections because these muscles help trap blood inside the penile chambers during arousal. They mean less ejaculatory force and reduced sensation at orgasm. They mean a greater likelihood of urinary leakage, especially after prostate surgery. And they mean that even if blood flow is adequate, the structural support for a firm erection simply is not there. What almost no man knows is that mindful solo sexual activity, done slowly and with deliberate pelvic floor engagement, is actually one of the most effective ways to rehabilitate these muscles. Think of it as physical therapy that you can perform privately, without a referral, without going to CVS Pharmacy for anything, without a Medicare copay. Contracting and releasing the pelvic floor muscles during arousal, the same movement you would use to stop urination midstream, strengthens the entire system over time. The Mayo Clinic has documented significant improvements in erectile function and urinary control in men who practice consistent pelvic floor exercises. This is not alternative medicine. This is standard rehabilitative care that most men simply never receive instructions for. And most importantly, your vitality and male potency do not have to disappear just because of aging. You do not have to accept this, much less depend on those famous blue pills that put your heart at risk. There is a natural and scientifically proven path. That is why, as a specialist, I strongly recommend that you apply the nitric oxide protocol. It is a simple 14-day method focused on clearing your arteries and reconnecting your master blood flow enzyme, restoring the firmness and energy of your youth. The pharmaceutical industry hates when we talk about this, so I do not know how long this material will remain available. Access it now through the link in the first pinned comment or point your phone camera at the code appearing on your screen now and download your complete dossier. A kiss and thank you for watching. Your body at 60 is not broken. It is asking for a different kind of attention, and now you know exactly where to start.